Hi, I'm Jason Pollock. I'm a board-certified obstetrician gynecologist with Murfreesboro Medical Clinic, and I'm here to answer some common questions about the COVID vaccine. So we've had several questions about the COVID vaccine during pregnancy and breastfeeding, and on July the 30th, the American College of Obstetricians and Gynecologists just updated their guidance to recommend the COVID vaccine for all pregnant patients and recommend the COVID vaccine for all breastfeeding patients, which is a much stronger recommendation than was made originally. This is based in large part due to the thousands and thousands of pregnant women in this country who have received the COVID vaccine without any significant side effects reported. So now that the COVID vaccine has been given to millions of women, and they've been able to study this population, and they've seen absolutely no evidence of impact on fertility. That's very reassuring for patients that have heard this rumor and are concerned about receiving the vaccine because of it. In addition, there's really no plausible scientific basis where we would expect there to be an impact on fertility. We've had additional questions about personal experience with our pregnant patients receiving the COVID vaccine. And I'll be quite honest, when the vaccine first came out, I was concerned about reports of people having high fevers from vaccination, and there is some information to suggest that high fevers during pregnancy could potentially be harmful. So that was my primary concern, but I've just not seen that with any of my pregnant patients that have received the COVID vaccine. Most of them had no side effects, or if they did, they were the mild side effects that you would expect from a vaccine, soreness in the arm, or muscle joints, aches, or discomforts that lasted in the neighborhood of 24 to 36 hours. And I don't recall any of them having to take medication for those side effects either. Now, in pregnancy, we have increasing information that pregnant women are more susceptible to the adverse outcomes from COVID infection, including hospitalization, need for care in an intensive care setting, and death. Some patients have had to have early deliveries in order to expedite their recovery process. And with increasing information to suggest that the vaccine is very safe and effective at preventing the serious consequences from COVID infection, we wholeheartedly recommend the vaccine to essentially anyone and everyone. By having more people vaccinated, you can reduce the risk of spreading it to people that are highly susceptible. So even young and healthy people can do their part and help their less fortunate counterparts not get sick and or die from this virus. So for anyone that has any additional questions or concerns about the COVID vaccine or COVID itself, please reach out to your medical provider to get factual, science-based information. And we'd be happy to do that here at Murfreesboro Medical Clinic.